became Attorney General in 2016, we faced a monumental challenge with an opioid epidemic that has devastated far too many families and communities throughout our state. And while we've since made what I think are meaningful strides in our ongoing efforts to combat this crisis, there are many challenges that still remain. If we want to effectively address this opioid epidemic, we have to connect across all areas of expertise to specify what each of us is doing and to leverage our strengths and our resources so together we can make a lasting impact. So that's why we created the statewide Opioid Task Force in 2017 to provide an infrastructure of communication between the public, private, and nonprofit sectors so that we can ultimately save lives. In 2022, there were nearly 2,000 opioid-involved overdose deaths throughout our state. That's nearly 2,000 family members, friends, co-workers, and neighbors who lost their lives to this crisis in 1 year alone. And it represents a more than 300% increase from 2010. This is a mental health issue. It's a public safety issue, and most importantly, it is a human issue. We talk to sheriffs who are arresting the same people over and over again because they're unable to access the treatment that they truly need to recover and rebuild their lives. Traffickers are preying on young Georgians with a history of addiction that's only made worse by the trauma associated with sexual exploitation. We know that this is a multi-layered crisis that requires a multi-layered solution, and that's exactly what we're here today to discuss. At the Georgia Attorney General's office, we're fighting this battle on multiple fronts, and we've declared war on fentanyl. Last year alone, more than 107,000 people in the United States died of a drug overdose, and fentanyl was involved in nearly 70% of those deaths. For perspective, that's more than 2 times the number of people who died in a car accident in 2023. With our gang prosecution unit, we're going after those who are trafficking fentanyl and other dangerous and deadly drugs that we're finding in our communities. When someone sells fentanyl-laced drugs that cause the death of another human being, that's murder, and it needs to be charged as such. And I want to commend our partners in Bartow County, where just last year, a 43-year-old man was found guilty of felony murder after he sold fentanyl-laced drugs to a 16-year-old in Daresville who died hours later. While no conviction can take away a parent's heartache after losing their child in such a tragic way, it's cases such as these that send a strong message to drug dealers and traffickers in our state. We will not hesitate to hold accountable those who profit off other people's pain. But we also know there's a difference between those that we're mad at and those that we're scared of. There are far too many Georgians across our state who aren't sure where to turn for help. There are organizations doing great work from recovery to prevention to education that are actively seeking additional resources to expand their efforts and reach even more communities. We've heard from law enforcement and first responders who are in desperate need of naloxone. In addition, given the potency of synthetic opioids, we know that when they respond to the scene of an overdose, they're putting themselves at risk as well. And yet they still do not hesitate to answer the call. For years, we were engaged in active litigation against various manufacturers, distributors, and retail pharmacies, and we worked tirelessly to ensure the best possible outcome for Georgia and its citizens. By joining several national settlements, we've been able to secure roughly $1 billion for our state and local governments to expand critical treatment, prevention, and recovery services, so that those who are struggling will have greater access to care. The funds will be received and distributed over time, with roughly 230 local governments, public service entities, hospital associations, sheriff's offices, and community service boards positioned to receive financial relief, including Rome, Floyd County, Cartersville, Bartow County, Calhoun, Gordon County, and Polk County.